So check this out. Sorry it's a little shady, right, in terms of the quality. ARA, that's L1 to L5, 11 degrees, should be 40. This is a chronic low back pain subject. Sacral base angle, 34. That's pretty close. It should be 40. The difference is 11 degrees within 80% of 34. So here's a real case, chronic back pain. Their lumbar curve, L1 to L5, is 11. Their sacral base is 34. Does it match? No, that's why they have chronic back pain. So then we intervene to change the lumbar curve. Here's my post-intervention x-ray. Now I'm at 39 for the lumbar curve, 39 for the sacral base. Do they match? Now they have no more chronic pain, and we follow them, and they stay like this for 1 to 2 years. We improve chronic back pain and health and disability by changing alignment. We'll talk about how. Another case. Before, 16 degrees, 29. 16 to 29 doesn't match. Number one, they both should be closer to 40 if they're normal subjects. Number two, the lumbar curve should be 80% of the sacral base angle. It's not. That's why the person has chronic back pain. The two don't fit. So then you correct their spine, 37 and 42, that's really good. And then you follow them for a period of 9 months and they stay corrected. How do you like it? To me, that's proper chiropractic. I find a problem, AKA subluxation, I intervene to correct it, I change or I show that I corrected it, and then I maintain that correction in somebody over time. We'll talk about that. Check this one out. You're going to want this paper too. If you're like me, 2017. This one is like the end. This is like the period or the exclamation point. This is the Chun paper, 2017, systematic literature review with meta-analysis. What does that mean? Put that in word or in terms we can process, Deed. They look at all the studies that look at chronic back pain subjects compared to normal subjects. They make sure that they're good quality papers. They make sure that they truly have normal subjects. They make sure that they have proper evaluations on the pain subjects. They make sure that they have proper x-ray standing upright radiographs. They make sure that they use valid and reliable measurement techniques. And then they include those papers in a review. Loss of the lumbar curve is strongly related to chronic low back pain. It is why you have back pain. When you match normal subjects to chronic back pain subjects in countries around the world, specifically 8 different countries around the world, you'll find out that they have loss of the lumbar curvature. The only way to find out is by taking an x-ray. Different paper, 2017, look at this. The Sadler paper, this one will blow you away too. Another systematic lit review. Done at the same time, but in a different journal, and they looked at different criteria. Check this out. This time, to be in the Sadler paper, all the studies had to be prospective follow-up studies. They wanted to minimum have 12-month follow-up in all the subjects, meaning they wanted to look at the cause of low back pain. Check this out. 12 articles with 5,500 subjects. Meta-analysis revealed the following: decreased range of motion and lateral flexion, loss of the lumbar curve, and tight hamstrings were statistically correlated with the development of back pain. Meaning, you might be asymptomatic now sitting there, but if you have loss of your lumbar curve, you're at high risk for getting chronic back pain within the year. They actually looked at studies that had 3 to 12-year follow-ups in this particular project, the Sadler paper. Whoa, yeah. Chiropractors have been saying it for years. Subluxation may not cause pain today, but you leave it there, what's going to happen? You're going to get it. Systematic literature reviews are now finding that out.